Excellent discussions. David, thanks so much for joining us to wrap up a lot of what we've talked about today and come away with some high points. It would be great to get your takes on that. We've heard some really powerful perspectives. We've heard it from people living with NCDs, from very smart diplomats, from folks in business, partners who play in the space, civil society leaders as well just now. What stood out most to you from these discussions, and what resonated for you?
We just firstly, look, thank you very much for organizing this, and for it's a pleasure to be here with you all tonight. What stood out to me, I think, was just firstly looking at the breadth of speakers, and then just reflecting on the fact that, if anything, NCDs is something that's common to all of us in terms of the challenges that we will ultimately face. And it's something that really unites us all. And so just that, I think seeing the partnerships, seeing the way that people are beginning to think in a systems-wide manner, and kind of bring efforts together. I think NCDs, they're hitting earlier, they're hitting all sections of society, all socioeconomic groups, and across all geographies. And it's going to cost us about $2 trillion a year if we don't get this right. That will continue. So I had some reflections on what needs to be done, and I made some notes as I was listening to the speakers today. So one of the things that really came out was moving from a reactive approach to a preventive approach, and what I heard discussed was 2 layers of prevention. And so the first is really the environmental, the lifestyle changes that can impact really positively in terms of reducing the burden of NCDs. And we were just discussing before we came in here, generally you hope that your kids follow in your footsteps, and I wish I'd followed in my kids' footsteps, because they don't smoke, they don't drink, they're actually leading far more healthy lives than we did, although they face other challenges, I think mental health challenges, which we could discuss more. So I think prevention is important. Also the role of vaccines here has been really underestimated, and I may speak about, depending upon how this discussion goes, that a little more later on. The other type of prevention is secondary prevention, and a couple of the speakers mentioned this as well, and that is that, if we're able to screen, detect, and begin treating earlier, we can actually prevent the onset of serious disease, or at least delay it, and that can have a profound impact both for patients and also for society and for our economies. So I think that's a really critical area. Critical takeaway message from this is the whole paradigm of moving to earlier.
Shashank was just talking about that, the importance of primary care, how holistic primary care can play a role here.
Absolutely. And so I think that, if we can begin to look at that, so it goes from diet, from lifestyle, all the way through to, vaccination, and then screening and early intervention. So it is a holistic approach. We heard about what the industry can contribute, and I took away 2 things, and I also wrote down some facts and figures. So, one of the things is the pace of innovation has really increased recently, and just to put figures on this, 1,400 new medicines introduced in the last 10 years. So this is really unprecedented. Really novel approaches to managing diabetes, obesity, and also mental health disorders, Alzheimer's, for example. So we're really seeing breakthroughs coming through here. And in terms of the potential, there's 9,600 medicines currently in the pipeline in clinical development for NCDs. So this represents 75% of the overall drug pipeline. So the potential is huge. Now, listening to some of the speakers, and I think John in particular brought this out, that innovation is great, but really the innovation, these aren't medicines until they get to the patients that need them. And so the way that we're looking at that journey, that patient journey, and how we can impact that at different points to ensure that they get maximally beneficial health care. And I think one of the things that I found most encouraging, I know that there are partnerships that are working on this right now. Industry's engaged in about 150 partnerships across 100 countries with 40 different non-industry partners working with us. But then what you heard was companies are actually beginning to come together as well and are working together. And he mentioned that 4-company collaboration. And you heard both Caroline and John mentioning Tanzania and that they'd recently travelled there. So I think coming together, that was another message I took away from this, that cross-sectoral partnerships, but the collaboration within sector itself is really beneficial.
I wanted to ask about that. I'm glad you brought that up, multi-sectoral partnerships. I mean, it's very clear this is not going to be solved and we're not going to be able to move forward with independent movements. Cross-sectoral, multi-sectoral partnerships are key. How can they be structured to move into action, from commitment to action? What are some of the measurable on-the-ground impacts we can start looking at?
Okay, so I think you've answered half the question here already, and that is, what gets measured gets done. And so there's a report came out from the Access to Medicines Foundation, and it listed most of the major multinational companies that are involved in NCDs, and what really struck me was all of them are setting targets for the number of patients they want to reach in LMICs, and different metrics from company to company, but it's all very concrete and very tangible. And I have to say, John, I was talking to your CEO about a week ago, and those figures that you mentioned in terms of some of the targets that you as a company have, they were emblazoned across his mind as well, because he repeated those. And this was in a very general discussion. But what I saw was a real sense of urgency to achieving these, and I see that across many different companies. So I think what gets measured gets done. I think that also underscores the importance of a political declaration that is concrete and really sets out objectives, because what we need to do is we do need to make sure that we are measuring and tracking towards impact that is going to change the way or the vision we have for managing NCDs and mental health.
This comes back, of course, to the Secretary General's point that we had a policy win, but an implementation deficit.
Yeah.
How can we make ourselves more accountable to results in this way? Measuring and getting the data is one thing, failing or succeeding rather than failing is another.
So I think there's another element of partnerships. So for this to work, you need partners that are committed, and the types of partnerships you're looking for are ones that are built on a respectful sort of relationship where you acknowledge the needs of the various partners and what they are able to contribute within this, and that's successfully leveraged around common goals. Because if you have common goals and you're all working in step, the likelihood that you will actually achieve this is far greater. So again, underscoring another important principle of the declaration, common goals within this, and then accountability. I think from an industry point of view, from what we've looked at is we've looked at 4 key elements to kind of what it's going to take and what this should embrace. And I think one is just ensuring that we support innovation. We have an innovation friendly environment. I think the next is a very strong focus on implementation. And that includes the type of measurement that we've been talking about. And then, I think just the whole notion of accountability here. And that's, I think, for every different actor within this, if you're contributing, you should be able to measure your contribution. It gets back to what I was saying about industry, just that ability to measure, track, and pursue it relentlessly.
Wonderful. We're almost out of time, but in the minute that we have left, we have an important meeting tomorrow, a high-level meeting in September. What's one action that the folks that are going into those meetings could take as a result? What would those be? What's one action they should take as a result from those discussions that you think would be a win?
I think it's around the commitment. I mean, innovation and access go hand in hand. So this isn't just about the next generation of medicines. Yes, that's part of it, but it's about facilitating access to those. So we need to think in an integrated way and solve the various challenges that go along that value chain, including financing, which is going to be even more pressing as we move ahead. So this is about commitment. It's about ensuring that we set goals, and it's about ensuring that the finances are there to sustain this.
Okay, great. Well, I want to once again thank you, IFPMA, for helping to support this discussion. I feel like FP can play a role in galvanizing those partnerships
And
as well.
thank you.
Our pleasure. But thank you so much for joining us and for giving us this wrap-up. I appreciate it. David Reddy, IFPMA.